This video is about psychological trauma, its mechanisms, causes, types, consequences, and suitable therapies. Our brains are designed to keep us alive. Every second, our brain is gathering information from inside and outside our body and making decisions about our safety. We don't have to think about it. Our brain does it automatically. If you are in a familiar, safe environment, our brain is only doing the unconsciousness jobs. If you are not in a familiar environment, however, your brain gets active. This is a chemical reaction occurring unconsciously in the brain. Our brain is telling our body to get ready to react as fast as we need to. We might feel nervous, our heart beats faster, and our breathing rate increases. Most of us have heard of fight or flight response, referring to our automatic reaction when we face a threat. There are in fact 6 different trauma responses: freeze, fight and flight, fright, flag, and faint. The initial stage of responding to potential danger involves freeze. Here the goal is to stop, look, listen to better understand the situation in preparation for action. Flight and fight are the second and third stages of responding. This process involves initial attempts to flee danger. When there is no escape, a fright takes over with feelings of panic, nausea, lightheadedness, and numbing. If there is still no resolution of the threatening situation, you will progress into the next stage, the 5th stage, flag, which is helplessness and despair. The faint response appears to serve several purposes from a survival perspective. When the body succumbs to a horizontal position, blood supply increases to the brain. Fainting is connected to disgust and emotional shock. In a moment of danger, these responses all happen automatically to try to keep us safe. Sometimes these responses can continue even when the trauma is not happening, as our brain and body continue to work to keep us safe from danger. Psychotrauma can be defined as the emotional response someone has to an extremely negative event. You can think about different forms of physical violence, as well as sexual and domestic violence, but also accidents, serious medical conditions, and the death or loss of a loved one. Some traumas are large and horrifying events like wars, natural disasters, or kidnappings. Some traumas are apparently small and more confusing or disorienting in the moment. You can think about mental abuse, abandonment, betrayal of trust, bullying, rejection, discrimination, and embarrassment. It is also possible to sustain trauma after witnessing something from a distance. Trauma can be a one-time event, a prolonged event, or a series of events. For example, the experience of repeated exposure to trauma or neglect, often in childhood. The emotional reaction to trauma is a normal reaction, and it occurs when one solution or response to a threat does not work. As a result, people may develop certain symptoms. These usually disappear on their own. Our brain can process and recover by themselves. However, for some people, the effects can be severe. They interfere with an individual's ability to live a normal life. In cases such as this, help may be needed to recover the emotional well-being. Some post-trauma symptoms manifest within 1 month of a traumatic event, but not everybody develops immediate symptoms. After facing a traumatic event, some unprocessed traumas can be silent for many years. Symptoms can pop up later at one point in life. It's not unusual that somebody was living in so-called survival mode for years, and the old trauma would eventually pop up during a stable, quiet stage in life. Everyone's experience with trauma is unique. Some people will develop every symptom, while other people develop very few. Post-traumatic stress disorder or PTSD occurs when normal symptoms become chronic. PTSD is a psychological condition that involves nightmares, flashbacks, avoidance of trauma reminders, high levels of alertness, negative beliefs about yourself or others, sleep or concentration problems. The event itself may belong with the past, yet the feeling of tension and fear still make the threat seem very real. Many people have a feeling as if the event could happen again. The trauma affects the ability of process thoughts and make good judgments. People can constantly feel shame or guilt. It affects the whole body and immune system. Usually people tend to push away these frightening feelings. This may also sometimes lead them to push away certain memories or become detached from their own feelings. But we don't recover from trauma by just deciding to get over it. It's like a ball you're trying to keep underwater with both hands. As long as you keep it underwater, you don't see it. If you let it go, it will jump straight up. Sometimes symptoms are masked by their very nature because there are symptoms of numbness and disconnection. If a person develops PTSD, professional help is usually necessary. Often problems arise at work, at home, or within the family and the social environment. Trauma is subjective and relative. Even if you do not develop PTSD, it doesn't mean you can't suffer from a traumatic experience. Some people struggling with depressive or anxious feelings develop low self-esteem. Others face difficulties in relationships, lack of trust toward others, and so on. It doesn't matter how big the trauma is at first sight. All that matters is how it influences your well-being. Even small traumas may need to be processed through therapy. If you have disturbing thoughts and feelings about a traumatic event for more than a month, if they are severe, or if you feel you are having trouble getting your life back under control, talk to your doctor or a mental health professional. Getting treatment as soon as possible can help prevent PTSD symptoms from getting worse. One of the most well-supported treatments for trauma is cognitive behavior therapy, CBT. It helps people to change their thought patterns in order to influence their behaviors and emotions. EMDR is another common trauma therapy. During EMDR, individuals briefly relive specific traumatic experiences while the therapist distracts them with eye movements and other tasks. EMDR aims to help people process and integrate traumatic memories. During exposure therapy, the patient is exposed to reminders of their trauma in a gradual and safe way. With enough exposure, the trauma begins to lose its emotional power and the symptoms diminish. Many other treatments, such as narrative exposure therapy, also have been found to be helpful. Medication alone cannot cure trauma or PTSD, but it can help a person manage symptoms such as anxiety, depression, and sleep disturbances. Medication can be especially useful when a person's symptoms are so intense that they are unable to participate in psychotherapy. And if you join a PTSD support group, you get the chance to hear other members' stories and insights on the condition. You may walk away with a new perspective and a sense of hope for getting better. It will feel good to have your own little community of people who can directly relate to you and offer up ongoing support. In summary, I'd like to emphasize that it's normal to have reaction to trauma. Most people are upset after trauma. Some have stronger reactions than others. No matter how a person reacts, it's still possible to recover. I hope this video was informative to you. If you like this video, give a thumbs up, share with your friends, and don't forget to subscribe. Thanks for watching, and I hope to see you next time.